Today we will discuss side effects of the penicillin antibiotics, or sometimes we say adverse effects of the penicillin antibiotics. Antibiotics have one of the most important side effect, that is the hypersensitivity. Hypersensitivity is allergic type of reaction, and penicillins produce type B or bizarre, that is also known as bizarre, that is dose independent type of the adverse drug effects. There are many types of the adverse drug effects that includes A, B, C, D, E, and F, and so many. So A is the augmented one, and that is the dose dependent, while B is the bizarre, that is the dose independent. So penicillins produce dose independent hypersensitivity reactions. The most important side effect of penicillins is hypersensitivity or allergic reactions, which can be serious and dose independent, meaning even a small dose may trigger an allergy. For the penicillins, it is said that even if you are taking a minute dose of the penicillin, if you are allergic, then it will produce the allergic reaction. Or if you are taking a larger dose, it will produce the hypersensitivity reaction. Means the dose, the hypersensitivity is produced in a dose independent manner. That's why we call the hypersensitivity reaction of the penicillin is type B or bizarre type. It includes a spectrum of reactions, with anaphylaxis being the most severe and life-threatening form. Anaphylactic reactions are caused as life-threatening by the penicillin antibiotics. And cross sensitivity with cephalosporins is low, but should be approached cautionally, especially in patients with a history of the anaphylaxis. Here, a new term is defined: cross reactivity or cross reactivity side effects. Cross reactivity refers to the appearance of the side effects due to the interaction of two or similar compounds. If someone has already used cephalosporins and now he is taking the penicillin, system in our body will understand penicillins as cephalosporins and produce the side effects. That is known as cross reactivity. So there can be the cross reactivity with the cephalosporins, but that is low and it should be approached cautionally. Means there should be a caution taken before taking the cephalosporins or penicillins if cephalosporins are already taken, because it may produce the cross reactivity reactions. Here in the picture, the symptoms of the anaphylaxis have been shown. That may lead to the hives, itching, wheezing or shortness of the breath, low blood pressure, and pale skin color. So these are the major side effects of the anaphylaxis reaction or anaphylactic shock. Sometime you have observed you get bite from insects, type of the dangerous or toxic insects. When they bite our skin, they produce a chemical that is histamine, and histamine leads to the anaphylactic shock and anaphylactic type 1 hypersensitive reaction. So that is also the same thing, anaphylactic reactions. So anaphylactic is one of the severe type of the type 1 allergic reaction. Life-threatening type 1 hypersensitivity reaction caused by the allergic agents like penicillins. Hypotension, low blood pressure due to systematic vasodilation, and increased vascular permeability. Whenever you get the anaphylactic shock or anaphylaxis, there is hypotension, means we have the reduction in the blood pressure. Bronchoconstriction that leads to the wheezing, airway obstruction, and respiratory distress. Anaphylactic shock is also characterized with the bronchoconstriction, means our bronchioles will become smaller in size. Due to reduction in the size of bronchioles, we may have difficulty in the breathing. We may have wheezing, or we may have the airway obstruction and respiratory problems. Skin manifestations such as rashes, urticaria, hives, and angioedema, like swelling of the face, lips, or throat. Some of the time we have observed that when an insect bite us, then we get that area and inflamed, and that becomes red, swollen. So these all are the symptoms of the anaphylactic shock. Other symptoms that may include dizziness, difficulty in the breathing, throat tightness, and loss of consciousness even. Second, one of the most important side effect that is observed by these penicillins include maculopapular rash. Here, two things are defined. One is the macule. Macule shows spread of a rash, and papule shows swelling of that particular area. So, in the maculopapular rash, there is spreading of the rash on the skin, and there is bumping of the skin. So it appears as flat red patches, macules combined with small raised bumps, papules on the skin. The rash is often accompanied by skin inflammation and may spread widely over the body. It can be spreaded over the body. Unlike immediate hypersensitive reactions like anaphylaxis, maculopapular rash is generally a delayed hypersensitive reaction, that is delayed type. Others, other side effects of penicillins includes oxacillin that causes the hepatitis and inflammatory conditions of the liver that may present with jaundice, elevated liver enzymes, and fatigue. So oxacillin, that belongs to the very narrow spectrum antibiotics. It may cause jaundice and liver problems, even major hepatitis. Then we have methicillin that also belongs to the very narrow spectrum antibiotics that may cause interstitial nephritis and immune mediated kidney inflammation, which may lead to the impaired renal functions. Means methicillin may impact on the impaired renal functions, and nowadays methicillin is not commonly used. Carbenicillin that belongs to the same class, very narrow spectrum penicillins, and that cause also bleeding due to the platelet dysfunctions and interfering with the normal blood clotting. Then we have nephicillin that is known to cause neutropenia, which is a reduction in the neutrophil count, potentially increasing risk of infections. So nephicillin causes the neutropenia.